Perfect. First of all, thank you for the invitation and for being able to present today our initiative. As you nicely presented me, my name is Bianca Băluță. I'm a policy officer on health and investments in Directorate General International Partnerships at the European Commission. What we are doing is that we are tackling and we have actions of the European Commission outside of the EU in other regions. What is here in the presentation, the Team Europe Initiative MAV Plus, on manufacturing and access to vaccines, medicines, and health technologies. As the title says, it aims to support manufacturing of medical products, including vaccines, mainly in Africa, and with a focus on sub-Saharan Africa. Why we think this is important? Because there is still lack of regular access to quality health products, and people, billions of people worldwide still lack access. So we don't have currently an equitable access. The COVID-19 pandemic exposed Africa heavy reliance on external resources. So we saw that because they didn't have access within the continent, they had to depend on the imports and other donations of doses for COVID-19 vaccines. And African Union has a very big and important objectives, which is by 2040 to produce 60% of its vaccines domestically. Currently, we have an import of 99% of its vaccines and 94% of its medicines. So we can see that the situation, it doesn't look good. So the Team Europe Initiative on Manufacturing and Access to Vaccines, MAV Plus, it was also a response to the African leaders to help them achieve this objective. And of course, the Team Europe Initiative MAV Plus is very linked with the global health because it's tackling exactly and discovering the SDG 3.8 to facilitate access to quality, safe, effective and affordable health products. It was launched in 2021, so as a response to the African leaders' call, but of course also as a response and as a result of how the COVID-19 impacted us globally. And of course this is built, the initiative is built in close collaboration with the African partners, as well as aligned with the strategies and the priorities of the African region. Is a flagship of the global gateway, which is one of our strategies, and also what I think it's important for the MAV Plus is that brings Africa and Europe together. So on one side we have a very strong approach on Team Europe, and when I say Team Europe, we refer to, of course, EU institutions such as, but also RTD, so research and development, but also the Health Emergency Response Authority, DG HERA, and also the European Medicines Agency. Then we have EU member states and agencies, which are very strong. We have a very strong collaboration at this level with, of course, Belgium, Germany, France, Luxembourg, Netherlands, Spain, and Sweden. But also we have the DFI, so the development financial institutions such as the European Investment Bank, as well as universities, research centers, and also the private sector, which is a very important part. On the African side, of course, we have the African Union agencies, we have the national regulators, regional bodies, universities, and manufacturers. And from the African Union agencies, we have a strong collaboration with Africa CDC, but also with AUDA NEPAD, also the national agency from each of the countries. The MAV Plus, it aims to have a 360-degree approach. What does it mean? Is that we are trying to tackle different angles and different perspectives. So the three dimensions that are core dimensions for our initiatives are supply, demand, and enabling environment. And when we are talking about supply, we are thinking about how can we support the proper local manufacturing. So local companies that want to manufacture, so it's also supply chains, and which involves, of course, the private sector. Then when we are talking about demand, we are talking about the market shaping or the shaping of the demand. And this involves collaboration with the main procurers, such as UNICEF and Gavi, but also collaborations with the national governments. And enabling environment, it's a broad concept, but mainly tackles all the factors that can influence the local manufacturer. And here we are doing a lot of work, which I will detail further, on regulatory strengthening. So we want to have a strong regulatory system harmonized at high standards in order, on one side, to ensure the quality of the products, but also to offer good environment for the private sector in order for them to make investments. Then we are talking about also technology transfer. So how can we facilitate technology transfer from the EU towards Africa? We are also talking about access to finance and the different financial instruments that we facilitate and we put as opportunities for the partners, and also, of course, research and development. How can we collaborate with universities, or how can we improve the number of clinical trials that are done at the EU level? And here, of course, we can talk about the EDCTP, which is an European, is the partnership EU-Africa that aims to increase the number of clinical trials on the African continent. And also we are dealing with the higher education and skills in order to ensure that we have the human resources that can be able to work in the local manufacturing. Now, as I said, the Team Europe is a broad and inclusive consortium. In terms of funding, is primarily funded by the European Commission, Belgium, France, Germany, and the European Investment Bank. But of course, there are also other, as I mentioned, other member states that are involved, and they have as priority or as focus the work under MAV Plateau, the local manufacturing. And also, as I mentioned, the African Union agencies, the national regulatory authorities, and what I didn't mention, and I will mention now, is the regional economic communities that are very important, especially also for the regulatory part. We have the pharmaceutical manufacturers, but also, as we already were collaborating with international partners, we are also collaborating them more closely under the MAV Plus. So we have Gavi, we have CEPI, we have the Gates Foundation, UNICEF, IFC, the World Bank, and so on. Now, the MAV Plus supports a broad portfolio of projects, as I mentioned, focused on the three dimensions. We have more than 108 projects, some of them already finished, some of them are still ongoing. We have 41 plus implementing partners, and we have managed to raise 2.8 billion euros. Of course, commitments from the European Commission, as I mentioned, together with Germany, France, Belgium, and EIB in a Team Europe approach. The projects can be at the different levels, can be at the continental level, can be at the regional level, or can be at the country level. We have 5 priority countries that we are focusing on in Sub-Saharan Africa, which are South Africa, Rwanda, Nigeria, Ghana, and Senegal. So these are the main countries where we are focusing our efforts. Of course, it can be also other countries, but these are these are the priority ones. Now, how MAV Plus is driving results and how what we have managed to achieve, but also where we still have to work to do. On the one side is the part of investments and the boosting the capacity of local manufacturing is basically the first dimension, so supply side. So we have over 700 million committed in loans and grants for industrial development and supply chain. And also here we have one specific financial instrument that is called Human Development Accelerator, which is a financial instrument aimed to support exactly the local manufacturers, but also European ones that want to expand or to invest in Africa. We have so far 5 companies that we are supporting and are focusing on vacuum manufacturing. Is the Afrigen, Aspen, and Biovac in South Africa. We have Institut Pasteur de Dakar in Senegal, and we have DEC in Ghana. And we also have 2 other health companies that are focusing on other health products, or not specifically vaccines. We have Emzor in Nigeria that is focusing also on production of the active pharmaceutical ingredients. And we have Akagera, which is located in Rwanda. As I mentioned, 5 priority countries, and we also chose them because of their development in the pharmaceutical sector and local manufacturing, but also because they have potential to become regional hubs. So what we aim under MAV Plus is not only to increase the local manufacturing at the country level, but for these companies to be able to become regional hubs, so to be able to also give their products to other countries in the region. This is all done. So the European Commission funding goes under our FSD Plus, which is the main fund, the European Fund for Social Development that we have under our Directorate General International Partnerships, and it's an open architecture, so provides 750 million in guarantees, but also we are also offering grants. So mainly the grants, the guarantees are going towards private sector, guarantees such as loans or different other financial instruments, while the grants are mainly going towards regulatory and other enabling environment projects. What is another way of driving results? So we have what is called the AVMA initiatives, which is a Gavi initiative, which was launched last year, which is a pool financing mechanism. It provides incentives to manufacturers to help offset the initial cost of development and production, and the instrument aims also to support purchases of doses later on a period of 10 years. And Team Europe is actually the biggest donor of AVMA. We together, so the European Commission together with some of the member states, we are contributing around 800 million to this instrument. And this is also an instrument that shapes the demand because of the further purchasing. So on one side, it gives incentives to the manufacturers, but on the other side, it also helps with predictable demand. Another way of MAV Plus and how the initiative is driving results is the fact that we are trying to strengthen the pharmaceutical ecosystem, especially on the regulatory side. So as I mentioned, we are trying to help with the harmonization, but also to increase the standards for our countries, but also the continental level. On one side, we have one technology transfer hub established in South Africa, which includes Afrigen and Biovac, which I mentioned earlier, and it's a program that is done through the WHO and the Medicines Patent Pool. Afrigen and Biovac are the hub is in South Africa, but the technology should be transferred to other countries as well, such as Nigeria, for example, or Kenya. Then through our support, or our support was part of the achievement of some of the national regulatory agencies to achieve maturity level 3 at the WHO benchmarking, which is Rwanda, Senegal, and Zimbabwe. This was only last year, so 2024. And we also provided regulatory training of staff. And also we have the Ghanese and Nigerian national regulatory authorities that play an important role at the regional centers for regulatory excellence. We also supported through different training courses in research, for example, in foundational research or clinical trials. It also helping them to enhance the regional expertise. And also we supported research in 2 regions and 2 countries with partnering with the different African institutions and European private companies. The last way of how we are trying to drive a result is that we are trying to support the different public health agencies, such as Africa CDC. We are supporting them, and also we are supporting the setup of the African Medicines Agency, which aims to mirror the European Medicines Agency. Is currently is in progress of being setting up and become operationalized. Actually, the new DG was appointed 2 weeks ago. Also, the African Union endorsed an Africa pool procurement mechanism, which we are supporting as well, and expand the PFM mandate, which is now called FAM, on basically manufacturing. And also the AU-EU partnership has been extended and expanded through the EMA, AMA twinning, and also the NRA, the National Regulatory Agencies Network. Now, just an overview. As I mentioned in the beginning, we have country actions, we have continental actions. So the continental actions, as I mentioned, the EU is giving funds to the Secretariat and Program of the Partnership for African Health Products Manufacturing, which is hosted under Africa CDC, so the FAM. On the UNDA-NEPAD, we are providing funds to UNDA-NEPAD per se to advance the African medicines regulatory harmonization, and also to help the operationalization of the African Medicines Agency and the transition that is needed from UNDA-NEPAD, that has been working on this for several years, to the new agency. Also, Belgium is supporting the operationalization of the African Medicines Agency as well. And also the EU member states, for example, Belgium and Germany, provide technical assistance to the UNDA-NEPAD and their program for the technical committees. As I mentioned, we are also closely working with the European Medicines Agency through a grant, where they need to help the operationalization of the African Medicines Agency, and basically in the twinning program that I was mentioning, to help them set up based on the experience that the European Medicines Agency has. And as I mentioned as well, the WHO, we are providing them a grant on one side for the mRNA tech transfer hub, but also on the regulatory convergence, harmonization, and use of the reliance mechanisms. At the country level, as I mentioned, we have 5 priority countries. We have South Africa on the manufacturing side. So on the supply side, we are supporting the Aspen Pharmaceuticals and also the mRNA hub. Institutionally speaking, we are supporting the regulatory authority, and also we help the establishment of the Regional Center of Excellence for Health Product Safety. And supported some regional biomanufacturing skills. In Nigeria, we supported the Emzor pharmaceutical to expand the facility for production of active pharmaceutical ingredients against malaria. As I mentioned, Emzor is focusing on the APIs. And on the institutional level, we are supporting the Nigeria's R&D and local protection plan, and we are also closely collaborating with the PVAC, which is the presidential initiative on local manufacturing. And here we see also a lot of government support and push, so it's even better. On Ghana, we are supporting the Dex Vaccine Limited, which is one of the companies in Ghana, to build their facility, fill and finish vaccine manufacturing facility, at least for the first part. And we are also supporting the strengthening of the Ghana National Regulatory Agency, so the Ghana FDA. At Senegal, we are supporting the IPD, the Institut Pasteur de Dakar, to expand its facility. And institutionally speaking, we are supporting the regulatory agency as well, and supporting also the government with their pharmaceutical sector reforms. Last but not least, Rwanda, we are supporting the Akagera Medicines Limited for early stages research and development. And also we are supporting the local companies in the health sector to reduce the barriers to investments. Institutionally, again, we are supporting the Rwanda National Regulatory Agency, and we are also supporting the establishment of a new master in biotechnology. And one of the first, the first actually biosciences park, life sciences park. Now, because the joint action was also to ensure the alignment with other initiatives, especially under global health. I think we all know that access to medicines is part of the global health. It is essential to ensure the access of course, effective and quality medicines. And what we are trying to do with MAV Plus is actually to make sure that the African continents become autonomous in producing their own products. So in case of a new pandemic or a new crisis situation, they will not depend on imports, which might take time, and some of the people will have access, maybe a delayed or a late access. Now, how we are trying to align in the current global health ecosystem. Of course, as I mentioned, we have the Global Gateway Strategy, which is still our European strategy to boost smart, clean, and secure connections in digital, energy, and transport, but also, and this is key on human development, to strengthen health education and research systems across the world. And in addition to what I've been saying about MAV+, the MAV+ is one of the Team Europe initiatives on health, but it's not the only one. We have 4 other Team Europe initiatives that are covering the SDG 3, which is good health and well-being, and the other 4 regional health Team Europe initiatives are focusing on one side on digital health, on One Health, on public institutes, and on the SRHR, so sexual health and reproductive health. Of course, we are also aligned with the EU Global Health Strategy, better health for all in a changing world. And of course, it's part of advancing universal health coverages and to deliver better health, because that's what we are trying to do with MAV+ and with increasing the access to the different medical products. And last but not least, and I think this is one of the most important alignments, is that we are aligned with the key African Union strategy, because this is the point to support or to have actions in the African continent, but this should be in alignment with the African continent strategies and objectives and needs in order for this support to become a sustainable long-term one. So, of course, we are fully aligned with the African Health Strategy, which goes until 2030. And also we are aligned with the African Vaccine Manufacturing Framework for Action, so the PAV that is now called FAM. And as well, we are also aligned with the new paper that the African CDC has published on financing in the new era. So financing in the current geopolitical context, when we are all aware that there are budget cuts and budget constraints, and Africa on one side needs to work more on the investment, but also on the domestic resource mobilization. And that would be all from my side. Of course, happy to take any questions you may have. Thank you very much.